Thank you. Today's April 15th, and it's a meaningful day in our city. It's One Boston Day. One Boston Day is a tradition that we started 6 years ago to commemorate the 2013 Boston Marathon. It's a day of service, reflection, and healing. We honor the victims and the survivors with acts of kindness. It's a day when Boston shines its brightest. This year's One Boston Day is very different. We can't host big events or service projects throughout the city of Boston. But the spirit behind One Boston Day is more important than ever. This is a One Boston moment. We're in the most vital point in the outbreak, with cases surging towards a peak over the next 2 weeks. Slowing the spread of the virus right now is critical to saving lives. That takes every single one of us to act for the greater good every single day. So this One Boston Day, we're asking people to stand together by standing apart. I'm calling on our entire Boston community to be there for each other, first and foremost by physical distancing, hand washing, and wearing face coverings when out in the public. Think of your grandparent or your elderly neighbor. Think of the healthcare worker or first responder. Think One Boston. I believe that we will look back on this week, One Boston Day 2020, as a turning point, when we made progress in slowing the spread, flattening the curve, and starting to turn the corner. We're also providing ways for people to connect and spread kindness in a meaningful way, but a safe way. At 2:49 p.m., the Untitled Church, which is close to the finish line, will ring its bells in honor of those we lost in 2013: Martin, Lindsay, Crystal, Sean, and Dennis. I have proclaimed April 15, 2020 as a citywide day of reflection, prayer, and unity. At 2 p.m. today, we'll be hosting an online interfaith prayer service. It will be streamed live at boston.gov. We will be joined by local faith leaders and musicians who will lead us in prayer and reflection. It's something that many of us need right now to help us get through this difficult time. I encourage everyone to tune in. Again, it's live streamed at boston.gov or on local cable access channels at 2 o'clock today. We're also sharing a list of kindness that everyone can do from home. We're sharing on social media, or you can find it on onebostonday.org. One of the most important acts of kindness on that list is thanking our first responders. Yesterday, we lost a local hero who dedicated his life to keeping us safe. Boston Police Officer Jose Fontaine passed away yesterday due to COVID-19. He was a decorated 29-year veteran of the Boston Police Department, a loving father and grandfather, and a friend to many. It's a devastating blow to our city. It's a devastating blow to our police department. I spoke with Officer Fontaine's wife and brother over the phone. I let them know that their city will never forget his sacrifice. And we will not stop fighting until we overcome this terrible illness once and for all. We need to keep the Fontaine family and all of the Boston first responders in our thoughts and prayers. We need to support them on One Boston Day and every day. I'd like now to hold a moment of silence. If you're at home or wherever you're watching, bow your heads and reflect on the events of 2013 and all the people that we have lost during this pandemic in the meaning of One Boston Day this year. There are a few other updates I'd like to share. First, a note about seeking medical help. We've been reminding people that if they feel sick, they should call their doctor or the 311 helpline before going to the hospital. We don't want to overwhelm the emergency departments. Many people have been listening to that message, and I want to thank you for that. But if you're having a severe or life-threatening emergency, like shortness of breath, difficulty breathing, or pain in your chest, you should call 911 immediately. Our EMTs, paramedics, and healthcare providers are here for you and ready to give you the care that you need. We don't want anyone suffering in silence. Those include people facing domestic violence or abuse, Don't hesitate. Call 911 if you or someone you know needs help. Our latest numbers as of yesterday were in the Commonwealth of Massachusetts, 28,163 cases, up nearly 1,300 from the day before. The number of deaths statewide were 957, up 113 from the day before. As of yesterday, there were 4,286 cases in the city of Boston. That's up from 200 the day before. And 84 deaths, up from 15 the day before. These numbers paint a stark picture of this crisis. More and more the data shows us who's being hit the hardest and who needs the most help. All across the country, the coronavirus is shining a light on long-standing health inequities. In Boston, we're putting equity at the core of our response. We're making sure the hardest hit communities have access to the information, testing, and the care that they need. Data is crucial to this work. We continue to post race and ethnicity data on boston.gov/coronavirus, and we'll update the numbers daily. Today we reached a different milestone. The numbers of deaths in all demographic groups are high enough for us to share race ethnicity data without exposing private information that's being protected. Starting today, we'll post race and ethnicity data for deaths as well as overall cases confirmed. As of yesterday, the data shows that out of 84 deaths in Boston, where races were known, 33% are white, 29% are black, 15% are Asian or Pacific Islander, 14% are Latino, and 9% have identified as other. We're going to continue to update and share these numbers publicly. It's important for us to get these numbers so we can make sure that we're getting messaging out to the different communities. We're using this information also to take other action. Our COVID-19 Health and Equities Task Force is meeting regularly. This group is made up of leaders of color, including doctors, faith leaders, and heads of community health centers. They're identifying key strategies to address inequities. Those include expanding tests, data sharing and analysis, and neighborhood outreach. These priorities will guide all of our work. We are currently working with the task force on a webinar about COVID-19 cases with Haitian Creole. It's one of the many efforts that we're allowing us to reach more people and communities in more languages. We're also expanding access to testing. We worked with Whittier Street Health Center in Roxbury to help make more tests available to the residents. Starting this week, the center is offering expanded schedule testing to all. On Friday, we'll be expanding services at our test site for first responders in East Boston to serve residents as well. Cobbin Square Health Center in Dorchester will have expanded access to testing by this weekend. And in the coming days, Brigham and Women's Hospital will expand services in their Hyde Park primary care site. They'll be offering screening and testing and other supports people need impacted by the coronavirus. Brigham and Women's will also deploy resources to other high-risk communities in the weeks to come. We are working with them to respond to the data on where testing is needed and helping prevent new hotspots from emerging in the future here in Boston. Today, I can also announce $1.7 million in new grants through the Boston Resiliency Fund. I'm proud of how quickly we stood up the fund and are getting resources out the door. It's aimed at driving our equity goals. The funds are going to organizations that serve our hardest hit neighborhoods and communities. The funds will be made available immediately as they will help close that gap. Our latest grants go to more than 6 community health centers to expand testing in Mattapan, Whittier Street, Bowden Street, Cobbin Square, Uplands Corner, and Dorchester House. Other grantees include family shelters in Boston, St. Francis House, and Rise, Massachusetts, and a number of other incredible organizations. I was on a call with these organizations this week talking about how vital they are right now. They do incredible work, sheltering, testing, and treating our homeless population and people with substance use disorder, including homeless families, giving access to food, hygiene products, and other important supplies, protecting the rights of immigrants, offering mental health services. These grants will allow them to expand their reach and help even more people. This is the power of the Boston Resiliency Fund. We are harnessing the generosity of Boston residences and businesses, and we're making sure those resources go where they need to make the biggest impact. In 1 month, we've raised over $25 million, with $12 million already out the door to local organizations. I want to thank the steering committee and all the donors for their incredible work and generosity. We're going to keep growing the fund, and 100% of the money will continue to serve these kinds of needs. For more information on donating or applying for these funds, we're asking you to go to boston.gov/coronavirus. There are a few more big contributions I'd like to share. The MAPFRE Foundation has committed to donating $500,000 to the City of Boston. We will use this money to buy critical supplies for medical professionals and first responders. Liberty Mutual, on top of what they've already donated to the fund, has committed $15 million in grants that will be distributed to Boston-based nonprofits. This includes $1 million for each of Boston Medical Center, Pine Street Inn, Boston's Healthcare for the Homeless, and $500,000 for St. Francis House, Friends of Boston's Homeless, the Greater Boston Food Bank. This commitment is addition, as I said, to the Resiliency Fund, and I want to thank Liberty Mutual for being such an incredible partner here in the City of Boston in this time of need. This is what a strong city does. We see a need, we work together, we meet it. We have mobilized our resources quickly and effectively. In a matter of weeks, we have created over 1,800 beds to increase hospital capacity to care for our homeless residents, to give our first responders and shelter workers space to isolate and quarantine. We got creative adding beds all across our city in college dorms and hotel rooms, motels, and at the convention center. We've distributed more than 28,000 laptops so our kids can learn from home, with another 180,000 meals so they don't go hungry while their schools are closed. We created a rental relief fund, a small business relief fund. We have the city's biggest lenders deferring mortgage payments to protect people's credit, and the list goes on. We did all of this together. I believe that a community shows its true colors during hard times. These are some of the hardest times we've known, and people are responding with generosity, hard work, patience, and kindness. That's how I know that we'll get through this crisis. Resilience is what Boston's all about. It's what One Boston Day is all about. This One Boston moment, I want to thank every single person who's a part of it. I want to thank you all for listening, and I have some pre-questions that have been sent in, and then I'll open up for questions to the press that's here today. From Danny McDonald at the Boston Globe. Is there a concern locally about the potential lack of ventilators and other medical resources used to help COVID-19 patients? The way to answer that, Danny, is that we're working this a day at a time. We're watching the numbers. We're hoping that we don't run out of equipment. We're still in the constant daily process of reaching out to the state and MEMA to get more equipment in here, masks, gowns, gloves, and other medical equipment, and also ventilators, something that we'd like to get more of. But we're monitoring the situation every single day. And I'm going to ask Marty Martinez if he wants to add to this answer.
Sure, Mayor. Yes, I mean, I think it's, we're working with the state. The state Department of Public Health is also working with us to make sure that we have enough ventilators for our Boston hospitals, and our hospitals are involved in an advisory committee at the state level that helps to make sure that those resources get distributed to the communities that need them. And as the Mayor said, we talk with our hospitals every single day to be able to understand where their resource needs are so we can help lift them up and meet them if we can.
And I think most people watching know that was Marty Martinez. He's Chief of Health and Human Services of the City of Boston, and he's doing an amazing job, working about 20 hours a day since this crisis started. So I want to thank Marty publicly, him and his team, for the incredible work they're doing. A second question from Danny is, what can be done, this is Danny McDonald from the Boston Globe, what can be done to improve language access in Boston regarding the pandemic resources and updates from the city? We've been working to make sure language justice and equity access to information is at the forefront of our response. Everyone, regardless of language they speak, deserve and need more information. Our text messages and alerts are available in 6 different languages. We have a website in 10 different languages. Each language has its own page with printed materials that go out citywide. You can get them on boston.gov/coronavirus as well. Last month, it'll be a month this Saturday, over 1,000 volunteers delivered multilingual information on COVID-19 to all the homes in the city of Boston, every single home. We focus on reaching seniors and residents in language access needs and those who may not have access to internet. We're looking at the needs for more mailings and lit drops moving forward. I'll be doing weekly robocalls for thousands of seniors in multiple languages, roughly 79,000 different seniors' households. Members of my team have been going out doing interviews with ethnic media in different languages, particularly our staff from Neighborhood Services. Our Office of Immigrant Advancement and our Office of Neighborhood Services and countless other departments are working with community organizations to share this information to people who are harder to reach during the language access barriers, We're working with community partners to get feedback, provide information, identify barriers and gaps in service, and strategize on interventions. If you're watching or you speak another language and you have somebody helping you, we'd like to volunteer your translation or interpretation services. Please go to boston.gov/ICA. We have another question from Adam Riley at WGBH. At this point, what are the odds of a full-fledged citywide shutdown in the next few weeks? At this point right now, we're focused on getting information to all residents on the importance of staying at home as much as possible, keeping distancing from others, wearing face covering while out, and all the precautions everyone should be taking to help to flatten the curve, which means wash your hands with soap and water as often as possible, clean down surfaces, and we have a recommended curfew from 9 p.m. till 6 a.m. As the weather starts to get better, and we're going to get better here in the next couple of weeks, it's getting warmer, we're asking people, please, no socializing. If you go for a walk, keep your distance 6 feet from each other. I'm hoping that we don't get to the point where we have to have a citywide shutdown, but we have a responsibility, each and every one of us, to do what we can to protect ourselves, our neighbors, our families, our friends. With that, any other questions?
On this one Boston Day, what feelings, what strengths from we all Bostonians experience in 2015 should we draw on?
The question is, on this one Boston Day, what strengths, what feelings, what we should be feeling about, what should be going through our mind, I suppose. And I can't speak for everyone, I can speak for myself. I was asked a question last night about one Boston Day and what it's going to mean to me. And I thought back to 2014. I was not the mayor in 2013. I was the mayor in 2014 for the 1-year anniversary. And on Marathon Monday, I was sitting and standing in the crowd, watching the marathon runners come through the finish line. And I watched the first group of runners come through, and I watched how Meb won the marathon. And Meb was the first American to win the marathon in, I think, over 20 years. And crowning him and hearing the national anthem gave me, and I think all Bostonians, a sense of pride here in the city of Boston. As the elite runners went through, I started watching people run through the finish line, and at that point, a lot of foundations hadn't been established. And I was watching people as they were running through with Martin Rich's name on their back or on their sleeve, Lindsay Lou's name on their back or on their sleeve, Crystal Campbell's name on their back or their sleeve, and Sean Collier's name. Officers from MIT ran through, and I watched them. And I was watching their strength and resilience, and I thought about how in 1 year, our city, we weren't fully healed, but we certainly rallied around each other and we support each other, where Boston Strong came from. And then I saw a Marine, I mentioned this too last night, the picture of him in the paper today, running down with a prosthetic leg and an American flag, and he had run the entire marathon. And I thought about his strength and resiliency, and I thought about anyone can overcome anything. And I think about today where we are here in Boston, in Massachusetts, in the country, in the world, quite honestly. And we'll get through this. We'll get through this one day at a time, and we'll be stronger for it. Just like we're a stronger city after the marathon in 2013, we'll be a stronger city after the coronavirus in 2020.
Can you talk a little bit about the tone of today? Obviously, we commemorate this day every year by coming together, like you said, with your comments. But do you remember back in 2013 something that clicked during that recovery before you were mayor that you are seeing now as we deal with this?
Yeah, the question is, after the marathon bombing in 2013, something that happened that kind of showed our recovery then and now. What I remember about 2013 is a couple days after the marathon bombing, people leaving their sneakers. And I thought how incredible that was in a sign of solidarity. And I think that exemplified who we are as a people, caring for each other. And I think today we're asking people to, leave your sneakers in a different way. Make a call to somebody. We have a list that we can go on and buy a gift card from a local restaurant, make a donation to a charity, call somebody you haven't talked to in a while. Just spread around some peace and love, because I think it's important for us to do that as people. I've seen it since I've been mayor. I've watched little kids make masks for me and for the city. I've watched older people make masks. I've watched people, care for, deliver flyers, make food for organizations, offer to make food for organizations, volunteer at a food bank. I've watched and seen all this stuff since this pandemic has started, and really, I don't want to say I'm amazed by it, but I'm heartened by it. I'm excited about seeing that we're going to get through this. And I think that there's no one moment in this particular situation, but today could be that moment, one Boston Day.
Where do you think we are right now, based on the recovery from 2013, right now, with this health crisis?
I think we're still a good bit away. I think we're at the beginning of the surge. What the latest model showed us as of yesterday, that we'll be at the peak of the surge somewhere between the 26th and 28th of April. So I think that we're still in the beginning stages. I think people, we're going to be, quite honestly, practicing and saying about social distancing and washing hands for quite some time. And I think that for a lot of us, it's kind of getting used to this way of life right now. And I think that by now, it's been a month now. Most people have been home for almost a month. Asking people to, if you don't have a good routine, try and come up with a good routine. Go online. I was looking at some things today about how do you get back into society. What can you do at home? There's a lot of great resources out there that you can use to kind of preoccupy your time, so you're not just constantly just engulfed in watching the news about coronavirus. That's not healthy either.
What's the testing capacity like? You were talking about Whittier Street is now testing around Boston.
The question is, what's the testing capacity right now? And I'm going to ask Marty Martinez to come up and try and address that.
So yeah, I mean, the desire is to get more people access to testing, right? So to make sure that our communities that we know are hardest hit and have disproportionate impact right now have more testing. So that's why through the Resiliency Fund, the mayor has been able to support these community health centers to expand testing. Some of them had already been doing some really minimal amount of testing, and now in partnership with us and with financial support and also just sort of helping on guidance, we're trying to greatly expand it in our neighborhoods from Mattapan, East Boston, Dorchester, and to Hyde Park to make sure that people can get access to testing. So we need to ramp it up, and that's what we're trying to do in partnership with the state.
Any other questions?
Thank you.
Okay, so remember, everybody, we're Boston strong.